This week's Ask Me Anything, I got a great question from a massage therapist on LinkedIn. They said they looked at my content and they noticed that I said a lot of things about neuromuscular treatments actually being ineffective and downright dangerous. So I wanted to cover why this is the case. And please, before you get mad or get triggered, watch the video and hear what I have to say. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment method that focuses on working smarter, not harder, allowing them to make well over $100,000 per year with less than 20 hours per week in the clinic. No gimmicks, just results. I said in the beginning, sometimes when you start to question things and you question other treatment modalities and people's identities, they get really pissed off and they want to scream at you and yell at you and tell you that you're an asshole, and they don't really want to have open debates about what's going on. So please, if you're a neuromuscular specialist, just watch the video first before you just blindly comment and tell me that I'm an asshole and I don't know what I'm talking about. I just want to go through factual, real data about why I believe and I can show you that neuromuscular treatments are actually ineffective and really downright dangerous. Well, a couple weeks back in one of my videos where I talked about cupping, I talked about the different types of biases we have as humans, and one of those is confirmation bias. So confirmation bias basically just means that no matter what, we're going to find and look for data that fits whatever we're thinking and where our mold is. And this happens a lot when people become more of a technician, more of just like a treatment focused person. They're like, hey, I do this one thing and this is the only thing that works and this is what's going to be able to go in there and fix it. They have a lot of biases and they don't want to see data from other things. They're not really willing to be open and understand that there can be different perspectives and look at it like truly objectively instead of looking at it emotionally. So always be aware of that confirmation bias. I've struggled with that a lot over the years too, where I want things to fit my mold, but then when I actually look at it from like a 30,000 foot view, I can understand that there's other factors in there and really just looking at that data objectively. Before I look at a treatment, I always talk about I have three criteria for it. Is it safe? Is it effective? Is it durable? So let's break down neuromuscular-based treatments. So are they safe? They're not really causing a lot of direct damage during the treatment. When you're doing a neuromuscular-based treatment, you're basically getting the nervous system to relax and allow some of that tension to relieve. So there's not a lot of direct danger with that treatment itself. You're not beating up a lot of tissue. You're not causing bruising. You're not causing a ton of inflammation. So yeah, they are safe for sure. On that criteria. Effective. So effective kind of goes to what makes them effective? Does the client feel better right away? Sure, that might be good, but that could be a problem. So are they effective? What are they really getting effective to? Are they getting to the root cause of why that problem is happening? Or are they just kind of going in there and playing a trick on the body and a trick on the nervous system, allowing that temporary window where it feels better, but they don't actually fix anything? And the last criteria is just durability. Are these treatments durable? No, they're not. Not at all. A lot of people, when they do these neuromuscular treatments, the client does feel better for 20, 30 minutes, maybe even a day or two, but that problem comes back because you didn't get in there and actually improve the function. You only improve the symptoms. So I hope you're still sticking with me. You're not pissed off just yet. Another thing that I always look at is there's an order of operations to fixing any musculoskeletal injury. Number one is you need to restore range of motion. Number two is you need to balance strength. Number three is you need to increase strength. And number four, this is only if you absolutely need to, you need to retrain the neurological system to work around that. This is where neuromuscular treatments go. They jump all the way to number four and they completely disregard restoring range of motion, balancing strength, and increasing overall strength. So I guess, what is he? The godfather and the founder of the neuromuscular movement, Vladimir Yanda, he even says in his own studies that before you ever fix a neurological component, you must first fix the peripheral dysfunction. And what he means by that is something out in the periphery is causing that dysfunction to happen. And most of the time, what it is actually an accumulation of scar tissue around the muscle, around the ligament, and around the nerve. And what happens is that builds up and then the nervous system doesn't fire correctly. A lot of people that default to these neuromuscular-based treatments, they think that it's just a problem with the brain. The brain just decides to not have a muscle fire, inhibits some type of muscle. And the key is you have to ask yourself the question of why isn't that muscle firing? Why isn't it working? And a lot of times it's because it's trying to protect a underlying problem. And a lot of times there's some damage to the bone, the cartilage, the disc, the tendon, or there's just a lot of scar tissue that's accumulated around that area. So if you go in and you're like, oh, the brain just decided that it doesn't want to fire, and we need to turn that back on, that's really actually dangerous and very reductionist type of thinking. Like I said, the founder of the neuromuscular movement says this in his own research. He says you have to fix the peripheral dysfunction first. So if you're just going in there and being like, thinking it's a wiring problem with the brain instead of looking at the full picture of what's going on, you're actually missing a big component of the injury evaluation and the treatment. Happening when you do these neuromuscular based treatments. So you got your spinal cord, right? And I'm gonna get all fancy with these words. There's this pathway in your spinal cord called your lateral spinal thalamic tract, and two types of signals kind of go up there. One of those is vibration and movement that goes through your mechanoreceptors, and the other one is called nociception, which is actually your pain receptors. So when you're doing these neuromuscular based treatments, what you do is you actually stimulate some of those mechanoreceptors. So they start firing and they start going crazy. So they block some of that pain. And then that restriction temporarily stops. The best example I can give you is like when you jam your finger in the door, what do? You shake it out like that. That's what you're doing. And that's what these neuromuscular based treatments are doing, is they're temporarily relieving that pain, but they're not fixing anything. And that is a big problem. Any treatment that focuses solely on reducing symptoms but doesn't improve function is downright dangerous. And this is why I believe that neuromuscular-based treatments are dangerous, because they temporarily feel better symptom-wise, but you didn't improve any of that function. So let's say somebody's got a low back disc injury and their glutes aren't firing correctly, or maybe their QLs are in a spasm. You do some stuff to make those QLs loosen, those glutes loosen. Now what you did is you actually exposed that disc and that degeneration in there, and now they're going out to do their activity and they're really exposed from there, and can cause a bigger problem and cause a lot of issues down the road. So the take home here is just check your biases. I see so many people, they become that identity, like I'm this type of therapist, I'm a neuromuscular based therapist, I'm this person, instead of actually being like, what do? I actually fix a problem, I solve a specific problem. Check your biases for that and understand, just because you do a certain thing doesn't mean that it always works, and really focus on just objective data as opposed to subjective data. So much of musculoskeletal treatment focuses on subjective data, like, hey, how do you feel? Anyone can make you temporarily feel better, but is that actually fixing anything? I always say pain is like your body's check engine light and tells you that there's a problem. And a lot of those treatments, they just basically turn the check engine light off for a little bit and then you keep going. Imagine if you did that with your car, your engine would blow up, you'd be in a really big problem. That's what's happening with these type of neuromuscular based treatments. They're not actually improving function, which in long term will not improve symptoms and expose you more and more to bigger problems down the road. Make sure that you're thinking critically. You're asking the right questions. You don't want to just jump right into treatment. Everyone wants to be a technician and just get their hands on people instead of focusing on asking the right questions. Why is this problem here? Have they had any other complicating issues around there? And don't just default to like, oh, it must be this because this is what I learned and this is what I do. Think critically, learn how to think critically, think differently, treat smarter, not harder. So if you like the video, give me a comment, like, or share. If you think I'm an asshole, send me a message and we'll talk about it. But really think about that. If you're getting triggered by these videos where I talk about factually about what's going on, maybe it's time to really examine your internal biases and understand maybe there's a different way to do things and it's not as effective as you think. Go get our free training. Follow us on all the socials, Instagram, LinkedIn, Facebook. Subscribe to the podcast. And more importantly, we got our 2022 schedule coming out this year for in-person CEU training. You want to get on that path to becoming a true solutions provider instead of a service provider. Come and get it. Appreciate you guys watching. And I'll see you on the next one. Bye.